Welcome to this edition of the Designs for Health audio science article.
The cat has long been out of the bag that eating fat doesn't make you fat, and saturated fat isn't the diabolical dietary demon it has been made out to be for over 60 years. Thanks to best-selling books and articles in popular magazines with large readerships, word is getting out that people can start eating butter again instead of vegetable oil spreads, and that a nice fatty lamb chop is nothing to be afraid of. And it's great that this message is getting the attention it deserves, but we can take things a step further. People don't need to put forth deliberate effort to avoid fat like the plague, but might there be specific fatty acids people might want to be certain to get enough of? Of course there are EPA and DHA, but what about any others? EPA and DHA aren't the only omega-3s, and even though the other essential fats, omega-6s, have a bit of a bad reputation, they are also essential. At least the parent omega-6 linoleic acid is. One of these omega-6s is gamma-linoleic acid, abbreviated as GLA, which is one such fat that many people may not have adequate levels of and their health may be suffering as a result. GLA is derived from linoleic acid as the product of delta-6 desaturase adding a double bond to linoleic acid. Delta-6 desaturase requires vitamin B6 as a cofactor. So, right off the bat, anyone with inadequate vitamin B6, along with zinc and magnesium, may be at risk for deficiencies of this special fatty acid. This may also be the case for the longer-chain omega-3 fats, since the omega-3 pathway also uses delta-6 desaturase in the conversion of alpha-linolenic acid to EPA and DHA. Other populations at risk for inadequate GLA synthesis include individuals with type 1 and type 2 diabetes, those with reduced beta cell function as insulin stimulates delta-6 desaturase, individuals with suboptimal thyroid function, cancer patients, and those with chronic viral infections. Overconsumption of trans fats also inhibits delta-6 desaturase activity. It's important that the fatty acid conversion reactions happen effectively because most people do not regularly consume the primary sources of preformed GLA, which include evening primrose oil, borage seed oil, and black currant seed oil. These all can be taken via dietary supplementation. Health-conscious people tend to avoid foods high in omega-6 fatty acids, such as soybean, corn, and cottonseed oils, owing to the role of excessive consumption of omega-6 in driving inflammatory conditions. But the eicosanoid story isn't quite that simple. Omega-6 fats possess pro-inflammatory and anti-inflammatory properties. GLA and the subsequent fatty acid in the omega-6 elongation pathway, dihomo-gamma-linolenic acid, are building blocks for the anti-inflammatory prostaglandin PGE1. Owing to its anti-inflammatory effects, GLA has been shown to improve signs and symptoms of rheumatoid arthritis. Unfortunately, the doses required may be off-putting to some, especially if it must be administered solely through capsules as opposed to liquid form. High intakes of GLA may help reduce the relative concentration of arachidonic acid in plasma lipids and in erythrocyte membranes, which may be an additional anti-inflammatory mechanism aside from providing the substrate for the PGE1 synthesis. Deficiencies of GLA and general fatty acid imbalances may play a role in the pathogenesis of diabetic neuropathy, due in part to functional and structural abnormalities of the axon and the myelin and membrane-bound proteins. Hyperglycemia and aberrations in insulin signaling may make things even worse. Glycation is no doubt a factor in diabetic nerve damage, but fatty acid imbalances may also be setting the stage and making the consequences even worse. Supplementing with GLA may help preserve the structure and function of neurons and facilitate healthy microcirculation. In closing, eating fat won't make you fat, but we still need to pay attention to the kinds of fat we eat and to the omega-6 to omega-3 ratio.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.